and I'm excited to see what people have to ask you. John has graciously offered to answer any question you may have. So please grill him. He's ready for it.
Well, Casey, it's interesting. Everywhere I've worked in any team that I'm a part of, I always tell them, you can ask me any question. No question is off limits. If I know the answer, I'll tell you. If I don't know, I'll tell you I don't know. And if I know, but I'm not at liberty to tell you, I'll say I know, but I can't tell you yet. So.
It's a secret. So, okay, let's start here. Are there any healthcare specific professional resources or associations you belong to that have been beneficial for you this past year?
Sure. So I'm a part of CHIME, which is College of Healthcare Information Management Executives. They have a lot of resources and forums that we connect to. Children's Hospital Association, we have a pediatric CIO forum. We have a couple of virtual events this past year. Those are extremely beneficial. I'll say I lean more on that particular one just because it's pediatric CIOs. We're always willing to share, kind of our mantra with that is, even if there may be a potential for our institutions to be in competition from the technology perspective, we're not competing. If we can help one another, we're going to help one another. So that's a really great resource. HIMSS is also one of the other ones that I'm a part of, but I'll say CHIME and CHA are probably the two big ones.
Okay. Do you have any advice for executives who are looking to grow their professional networks?
Yes, I do. So a couple of things. So you have to be intentional about it. But there's another organization that I failed to mention. I actually joined this one during the pandemic. It's a SoCal SIM organization, Site Information Management, and they have a lot of great resources that they put out. So I definitely am a big proponent of that organization, that networking. But the key is finding which ones kind of fit what you want to learn more about and can help you grow. And then once you identify those, commit to being engaged and participating actively. I think that's really the most important thing. I think one of the other things is if you're not someone who historically has done webinars or presentations at different conferences, start to identify those types of things that you can do. That starts to open up your network and you get more exposure and that kind of helps you expand and grow your network. So I think those are some really, two of the really key things I think to consider.
Yeah, definitely. One here, what are your concerns with security related or security issues with telehealth communications within healthcare, and how do you plan to address them?
Well, I think I don't have any major concerns, quite honestly, about telehealth and cybersecurity in general. I think as long as you put together your foundation of how you're managing your environment, whether it's on-premise or whether it's cloud-based, and you have a good program in place. That's number one. And as long as you have those things in place and you select a solution that is HIPAA certified, then you put yourself in a really great position. Because once you do that, there's always going to be scenarios or ways where people may try to find their way in. But if you have the core processes and the core foundation in place, you're in a much better position to defend against that and or recover if something does happen. So I think that's really the key.
I have just a quick question following up with that. Do you think that technology for healthcare will become like more intuitive in that like EMRs? I know like the software is always so different. You can't share the records like between hospitals and things like that. So are you like seeing that things will become more intuitive that way or more connected that way?
Right. So I don't think that's a short-term thing that'll be achieved, because that one is difficult, because each EMR has their own patient portal and access to information, but they're not really consumer-facing solutions, and so they all really fall short. So really, you as an organization, you have to figure out, how do I provide an overlay to that so I can create a better experience for the patient and patient family. So I think that's part of what we're looking to accomplish. And I know that's really the future, because our patients, they've been tolerant with what they have today, but that won't last for long. They'll demand it, and we're trying to get to a point where we're offering it as opposed to them beating down our door saying you're not meeting our needs. I think what Apple has done with trying to bring all that information together is a good start, but it's we have a long way to go. And one last thing I'll say about it, and maybe sound like I'm on a soapbox, but the interoperability piece between the EMRs and one another, although it's there, I would still say on a scale of 1 to 5, with 5 being the best it could be, we're still at a level 2 at best. And so as the interoperability gets better, that helps us make the experience for the patient families even better.
So one here from Joseph says, with regards to a mobile and mobile security's perspective, how do you see wireless helping the healthcare industry, and how has it helped CHOC? Where do you find it more impactful? And would you like to see it changing the technology?
Wireless is everything from whether you're in the hospital, whether you're in an ambulatory clinic, wireless really gives you more reach and more capability. So it's been tremendously beneficial for us. We deploy a lot to mobile devices. A lot of our solutions are mobile ready. So that's extremely beneficial. It gives you anytime, anywhere. Mobile secure text communications is critical in an inpatient facility. So that's really, really critical. Medical devices, they run, most of them now, a lot of them they're wireless. And so that has to be secure. They have to be segmented. But that wireless network infrastructure is critical. So you have to keep that current. I can't advocate for that enough. You can't let the wireless infrastructure within your facility get out of life in the support, because you're only putting yourselves more at risk, and you limit your capabilities for what you want to offer to your patients, patient families, and providers.
Mm. That's kind of tied into one here from George. He asked if there's any specific technology that has flourished during the pandemic more than ever before. And I think we've kind of touched on, like, obviously, like telehealth and like maybe the wireless aspect of it. But do you find that there's
Oh yeah, those for sure. Those for sure. I think some of the other things, even just virtual environments as a whole, are have created a lot of benefit. I think one of the things we did as it relates to the vaccine, as we had to vaccinate our providers and the folks at CHOC, we wound up creating a custom solution for not only scheduling your vaccination, but also the vaccine tracking. We also developed a mobile app for self-screening. And so those things were tremendously beneficial, not only from an efficiency perspective, but it just gave us the opportunity to be more modern with what we're trying to accomplish. And it made it easier for us to do all the reporting to the county as well as to the state for all the reporting you have to do around those. So I'll say those things. Having that great wireless network was beneficial, and it helped us be able to do that. We even did some thermal scanners. So I'll say I'll also do a shout out for that. Thermal scanners were extremely beneficial as well, because it allowed us to reduce the number of folks that we had manually screening.
Oh, very cool. That's cool. How can your vendor partners help you better achieve your goals?
They can listen, and they can not tell me that they can solve all of my problems, because no one has that kind of scale and depth, and just really listen to what our problems are. And if bringing solutions that will help us solve those. And when they don't have the capability, tell me you don't have the capability. One of my biggest pet peeves is a vendor that tells me they can do it all. And then when you start going down the path and you find out that they can't do it, then you're both in a really bad situation. So that's my key things.
Transparency, it's important. I think we have time for maybe like one or two more. Let's do this one. Has cloud adoption increased during the pandemic? And if so, how has it positively impacted your goals?
Oh, right. Absolutely. I think just across the board, cloud has grown in adoption from the pandemic. We were already on that journey, We had been going down a data center modernization program, and we're in the last phase, which was really moving all of our disaster recovery capabilities into the cloud.
Mhm.
So we're in the midst of that right now. We hope to wrap it up by end of June, but that's tremendous for us. But our other thing is we want to go cloud first. There has to be a compelling reason for us to have something on premise, and sometimes there is in healthcare. So some of the technology and some of the medical equipment devices, we have to have things on premise, and so those make sense. But if it can be moved to the cloud and it's a SaaS solution or it's cloud ready, that's where we're going to be.